Good afternoon and welcome to Webinar Wednesday. Today we are joined by Ryan Gonzalez, Director of HTM Cybersecurity at Sodexo, with guest presenter Chad Holmes, Security Evangelist at Scenario. Webinar Wednesday, we'd like to thank our sponsor, Sodexo Healthcare. At Sodexo Healthcare, they build trusted partnerships with health systems to support quality care delivery. As part of their mission, Sodexo HTM helps improve patient outcomes through integrated technologies and operational efficiencies with flexible solutions to meet your needs. For more information, please visit us.sodexo.com/HTM. We want you to be up to date on the latest news from the TechNation community. So in the handouts section of your webinar dashboard, you'll find a few PDFs, including the pre-show planner for our HTM Mixer in Baltimore in May, from May the 11th to the 12th, information on the call for presenters for the full MD Expo in Orlando, which takes place the 29th to the 31st, details on our HTM Week contest, and applications for the 2023 class of 40 under 40. The deadline for that is the 28th, so make sure you get your applications in. Okay, today's webinar is eligible for 1 CE credit from the ACI. You can obtain your CE certificate by completing the post-webinar survey, which will be emailed 1 hour after the completion of today's webinar. You must complete the survey to receive your 1 CE credit from the ACI, and you'll be able to download the certificate directly from your computer once the survey is submitted. If you have any questions, you can reach us at webinar@mdpublishing.com. Let's kick off today's webinar by giving away one of our Webinar Wednesday t-shirts to the attendee that can tell me the answer to the following trivia question. Sodexo's US office is located in Maryland. What is Maryland's most famous food? Answer now using the questions feature on your dashboard, and I'll reveal the answer at the end of the webinar. We'll wrap up today's presentation with a live Q&A, so please submit your questions anytime using the questions feature on the webinar dashboard. As I mentioned earlier, our presenters today are Ryan Gonzalez and Chad Holmes, who will be discussing top 3 cyber risk reductions your HTM team can start today. Ryan, you may begin whenever you're ready.
Well, thank you for that warm welcome, and thank you for everybody who is joining us today as we try to break down some of that confusion and a little bit of the overabundance of information in this space. We're going to try to give some practical advice on things you really can start doing today. We're going to discuss how you can do some of these things at no cost, no additional FTEs, or if you have an IOMT software or would like one, how you can really use that to accelerate and optimize all these things we're going to talk about today. So we will start off with some more formal introductions. I am Ryan Gonzalez. I'm the Director of HTM Cybersecurity for Sodexo. I started in the HTM field as a biomed at a large healthcare system, and I've been in this space for over 17 years as not just a biomed technician, but as a clinical engineering supervisor, a manager, and now leading the cybersecurity division for Sodexo's HTM program. In my current role, I'm working on defining how Sodexo does cybersecurity for medical devices, the policies and procedures that surround those medical devices, them being on the network, and how we keep them safe on the network. And with me is Chad Holmes. Chad?
Hey, thanks, Ryan. And my name is Chad Holmes. I'm a cybersecurity evangelist for Scenario. That means I get to work with a bunch of really, really smart people that are working to not only help HTM team members do their job better, but entire healthcare organizations to actually better protect their environments. My background is a mishmash of bits and bytes. I started as a software developer, got into penetration testing, and then got into startups, and cybersecurity kind of naturally evolved from that. So very, very happy to be presenting with Ryan today.
All right, well, I'm glad you're here with us too. So we're going to start by setting the stage a little bit. There's been a ton of great research done in this space in regards to data breaches and ransom attacks within healthcare. I've attempted to compile some statistics that I really think help guide our approach to best practices within this space. So we're going to ask, why do hackers target healthcare? And I believe there's really 2 main reasons. The first is healthcare presents one of the biggest, most up-to-date treasure troves of information in this industry. or of any industry. So think about every time you go to the doctor or an urgent care or ER, the first thing they do is hand you a stack of papers filled front to back with questions and ask you to verify all your information, your address, your social security number, your health insurance, your health ailments. And these questions don't just include your health information, but also financial data about yourself, about your spouse, about your, and then questions about your family. You know, who's your parents? What ailments do they have? The amount of information your healthcare provider has on you is immense, and it's all updated every single year. So for me, that's the reason number one why attackers really target healthcare, because it's such a treasure trove. So we'll talk about number two here at the end of this slide, because first I want to touch on some of the statistics around this. Last year, according to the HIPAA journal, there were 707 verified data breaches of over 500 records. And those are just the reported and confirmed data breaches, where reports suggest that 43% of all hospitals have had some sort of ransomware attack last year. The most recent studies by the Panama Institute revealed that 68% of all healthcare data breaches resulted in longer lengths of stays, and 70% resulted in increased patient transfers or diversions. And these two statistics are really important. The longer lengths of stays are due to canceled or delayed procedures or surgeries, delayed results from your labs, radiologists' inability to read a scan. And then those patient diversions are extremely important because it's estimated that 16% of all hospital admissions come through the ED. So when diversion take place, that's a lot of revenue that's out the window, and also all those patients who are sent to further away hospitals, it's worse outcomes for them. So these two things contribute to the next two statistics here in the middle, where the average cost for 2022 was $10.1 million. Now, IBM does a data report every year on the annual cost for a data breach. And in 2021, that cost was only $7 million. Now it's up $3 million in just 1 year's time. And one of the reasons this is so expensive is you can see that next stat there, 277 days is the average life cycle of a healthcare breach. And 202 of those days, the hospital didn't even know they had a data breach. That's a lot of time for hackers to be in your system taking data. So all of these statistics combine for what I think is the number two reason hackers target healthcare, and that's because 47% of hospitals choose to pay ransoms due to all that potential costs, the long timelines, the length of stays, the impact on patient outcomes. It's the highest percentage of any industry on paying ransoms. And Chad, I think this statistic is actually from a recent study that Scenario did. Would you like to talk a little bit about that?
Yeah, absolutely. That is from one of our recent studies. I love the stats on this page. You've pulled from a bunch of great sources here. One of the really great things that we've seen happen in the last 3 years in healthcare is a lot of these studies are happening. Ponymon Institute, as you mentioned, has done a great job. We've worked with them. Other vendors have as well. So at the end of the day, we have to think of healthcare as a different industry from anything else out there, right? Because we don't measure victory, success during our job in terms of dollars and cents. Other industries can do that. We have to take into account, are we protecting patients? Are we providing good care? And at the end of the day, a lot of hospitals are faced with this really bad decision of they don't want to pay the ransom, but the ransom may be the fastest way to getting back to providing patient care. So that's the battle we're seeing. And the common guidance that's often passed around is never pay the ransom, but always be prepared to do so. And the result is we have a coin flip mentality. Half the time we're paying it, half the time we're not. And when you don't, you're probably going to see a much larger cost of breach. The reason being, and I want to hit on what Ryan started on the slide, the reason being is that data is not only incredibly valuable and up to date, it's also relatively static, right? You might change your name, you might change some personal details, but at the end of the day, you're not going to change your family history. You're not going to change a lot of that data that can be used for fraud. Whereas if someone stole your credit card number, your bank account, you can cancel those rather easily. So the reality is we have this really big financial target on the healthcare industry, that attackers have also realized is not as well protected, is not as well invested in, and over the last 3 years has frankly been distracted by trying to recover from COVID. So at the end of the day, it's justifiable to see why ransoms are being paid, but it is also helping to contribute to additional attacks going forward, and that's what we're.
Yeah, that was great, Chad. So let's look at, we've defined the uphill battle we face, and luckily there's some guides and frameworks to follow on how to prevent these sort of cyber incidences. The problem you can see on this slide here is that the amount of frameworks are also a bit overwhelming. That Panama, they did another study where they surveyed 579 healthcare IT professionals on which standard or cybersecurity framework they're currently using. And as you can see here, there's almost no consistency. There's over 10 different standards represented here. So if you're just starting out, how do you know which one of these to pick? You know, they're all excellent frameworks. They all give great practical advice. And to be honest, if you choose any one of them, you're going to be better off than when you started. But most folks don't have the time to go through each one of these frameworks to decide which one's best for their organization. These are 50 plus or 100 plus pages long. It is a lot. It's a big journey. So where can we start? You know, when we try to start a cyber program, we're immediately hit with another list of struggles for our medical device cybersecurity. We know HTM is historically underfunded, and more often than not, doesn't have any dedicated cyber staff. The average biomed and imaging technician, they're asked to support more hospitals with the same staff. You're given tight timelines for inspections, for PMs, your CMs, your projects. It just keeps getting more. And then here on the right-hand side, you can see all those things we just talked about. Cybersecurity is really hard. There's an overwhelming number of standards to follow. The visibility for all of your medical equipment is a huge challenge. There's more vulnerabilities than there is time in the day. You have thousands of manufacturers and models that each have different standards as to what you're allowed to do to that equipment. So let's talk a little bit about what we can actually do. Let's give you something tangible. So step one, we look at, step one of any cybersecurity program is always identify your inventory. And this is your basics. This should be no surprise. It's nothing novel. Most programs I see in the HTM space, they're out there, they go to the computer, they do an IP config all, and they write down IP address, MAC address, maybe even a default gateway. But this is your bare minimum, not just for cybersecurity, but for any HTM program. Every single HTM program in any hospital should be doing this. Not just for cybersecurity, like I said, but for your own repairs, your own maintenance. If you have an EKG cart that breaks and it needs a software reload or a new bridge, you're going to need this information to get it back up and running and back into service. We need to move past this bare minimum to the next level of documenting our inventory. And this is where a tool like Scenario can really come into place and optimize that inventory capabilities. Chad, if you want to talk to this slide.
Yeah, absolutely. So Ryan, you said a word a couple slides ago, which is incredibly important here, which is practical, right? It's not practical for a hospital to go through and analyze every single cybersecurity framework that's out there, because you have to save lives, you have to protect patients, you have to treat them. So when we're going and when our teams are working together, we have to think about what is the best way to get data. In that screenshot Ryan just showed, where you're opening up a DOS prompt and you're hitting every single device one by one, very valuable, great data there, but to do that in a hospital that likely has thousands of devices is incredibly time consuming, particularly when they're always being onboarded, offboarded, configured differently, and it's a never-ending challenge. So what we're seeing in the industry happen is, rather than having that kind of manual approach to finding every single thing, we can automate a lot of that process. And the reason we can automate a lot of the process is kind of a good and bad scenario. The good is we can automate it. The bad is we can automate it because these devices are very chatty, which tells us the info, but also makes them very susceptible to attack and spread of attacks. So what you're seeing here is a much more in-depth version of what Ryan showed on the previous page, where It's not going into a DOS prompt, typing a couple commands and getting the details back. It is watching network traffic, all the time overnight, so your team doesn't have to go and do it, and then gathering all the information for every single device that's out there. So instead of having to think about device A, then B, then C, you just go into a dashboard like the scenario one you're seeing here, and not only will you see all the devices, but you can dive very deep into the details about what the device is, what its IP address is, physically where it exists, where it needs patches, risks that it may have, etc. So the real value in this comes in the automated nature of this and the very clear guidance on what needs to be done next. It is a very practical approach to identifying, maintaining, and securing these devices rather than the really manually heavy one that we've relied on for years.
Yeah, absolutely. And then as we get this down and we start to mature our identify capabilities, the next step that a lot of hospitals have not yet matured into is classifying it here. Like this is another snippet from Scenarios tool chat. If you'd like to go over this one real quick.
Yeah, and I love this screen because it's kind of the shock that people need to realize to see how big their environments really are. That last screen we were looking at, I believe it was one IV pump, and you start to realize, okay, the average environment has about 10 to 15 devices per bed. Now, they're all not necessarily bedside, right? A CT machine is down the hall, but the reality is there are hundreds and often thousands of devices that are out there, and very frequently they're not devices that you might expect. You absolutely expect the infusion pumps and the nursing stations and the Wi-Fi points, but we find that customers often don't expect that there's a Tesla on their network, or that there's a Sony PlayStation on their network, or that there's a dozen Alexas because people bring them in because they want to listen to music. So the reality is, it's very, very difficult to maintain the individual devices, but it's also really, really hard to know all the devices on your network if you're not doing it in some kind of automated analysis way. And this is the real wake-up moment a lot of our mutual customers have, where we show them the full footprint of all these devices, where they exist, the risks they have, etc. So Ryan, back to you.
Yeah, and then with identify, it's not just enough to identify our inventory. We really have to mature to that next step of identifying what all of this inventory is capable of. So these are things like, does your device store patient data? And if it does, how much patient data is it storing? Is that storage encrypted? Does that device, what's that device doing on the network? Does it need external internet access? What data is it sending across the network, and is it encrypting that data before it sends it? How about password protection? How can you secure your device with more unique passwords instead of that standard default that every biomed shop in the country is using? Is your device capable of having Active Directory on it? And then we start looking at things like, can you install antivirus protection or malware detection on it? At Sodexo, we've identified about 25 of what we call these critical, network critical data elements that we focus on, so we can really understand what our devices are doing on the network and how we can protect them on the network. Because from a cybersecurity perspective, these are really what you need to have a grasp on when you look at your full inventory. And many of these questions can luckily be found on the MDS2 from the manufacturer. The MDS2 is required to be provided by the manufacturer. Now, getting them from the manufacturer can often be a different story. It can take a lot of phone calls or a lot of emails if you don't have the right policies in place before you purchase the equipment. So that is where we can sometimes lean on our partners in this space, like a Scenario, who has done a lot of work already collecting these and even digitizing them. So this is an example of what an MDS2 looks like in the Scenario platform. So Chad, if you'd like to talk this one.
Absolutely. So I feel like we should have just said this was the good news, bad news webinar, because this is yet another situation like that. So the good news is every device manufacturer has an MDS2 to some degree. As Ryan was saying, though, the bad news is getting them, right? You would hope you get a big shipment and the MDS2 is included in the shipment. But the reality is a lot of manufacturers may not provide them. It can be hard to get them, like Ryan was saying. You got to harass them a little bit in some cases, which is unfortunate. The really good news here, though, is there's a collective wisdom that happens when you start to digitize these. So in our case, when we work with the Sodexo team and the manufacturers and all our customers, when we get an MDS2 form for one device, and I'll continue to pick on infusion pumps because they are so numerous, but when we get a MDS2 form for an infusion pump or get updates to it, it's not just about that one customer or that one incident. All of our customer base also gets the updated MDS2. So the reality is, as you have this collective wisdom, it's no longer about harassing every vendor every time you get a new shipment. More likely, it's about those devices being automatically identified when they're onboarded to the environment, and the MDS2 form being just automatically updated. So the more and more deployments we have, the more and more readily available they are. Now, the other good news here, I'm going to leave on some good news, is again, this is all digitized, it's all searchable. So you don't have to say, hey, we have 12 different versions of infusion pumps. What are the standard settings? The reality is you can just drill down to the ones you care about, click on MDS2, and boom, there's all the information. So these are notoriously difficult to get with some particular vendors, but when they're all in one central location, it becomes incredibly valuable, and we're more than happy to work with our customers and teams like Sodexo to make them available.
Thank you. And let's go into our step 2, and this is prioritization. So prioritizations of your devices and the risks. The beginning stages of this step is not that different than what you're already doing for prioritizing your repairs on your medical equipment. You look at the business criticality and the patient safety. So you can understand what type of impact this equipment has when it fails, either on a patient or in use. So it's either unusable or there's some sort of ransomware attack that prevents it from being used. For business criticality, we look at the potential disruption for your hospital operations. And this is very hospital specific. So in most cases, like a single ultrasound, for example, it might be an inconvenience for your staff and your patient if the single ultrasound fails, but you might have spare, or you might be able to send them to a different department or delay the procedure a little bit. And this is kind of the case with any high volume equipment. If it breaks, you swap it out. On the other hand, you have your CTs. If you look at a CT and an ED, you have to analyze the business criticality of that. So part of that is analyzing, well, how big is your ED and how many CTs does it have? If you're a large triage center or trauma center, you might have 3 CDs or CTs. So when one goes down, there's going to be some impact on your operations, but it's not detrimental. Whereas if you're a smaller hospital and you only have 1 CT, and when that goes down, it's a huge impact. That's where you get into those patient transfers and patient diversions that we talked about. These sort of large scale, pricey imaging devices have a huge impact. Now, patient safety, when we look at this, we have to look at it through the lens of how much harm is going to occur to a patient if it goes down or it's compromised by ransomware, especially when it's in patient use. That ultrasound, again, if it goes down, there's very little to no harm for the patient. Whereas a ventilator, on the other hand, this would go in the life critical category because it can be catastrophic. This is where it can result in a patient death. And these would be things like those ventilators and anesthesia machines. Now we have a high risk category. This is where it would pose serious harm, but probably no death, most likely. And this would be maybe a portable X-ray or an ESU. And then that normal risk is probably your ultrasound type devices. So just like we talked about in our inventory, this is kind of your bare minimum for prioritization. And when we talk about cybersecurity, we have to go a little bit further. So when we do that, we look at the device risks. So we have to prioritize our cybersecurity risks through the risks these devices face. So each cybersecurity vulnerability really should be given 2 scores. The first is your CVSS score, and this is your common vulnerability scoring system, and it's a qualitative measurement of severity. So it's on a scale of 0 to 10, 0 being none and 10 being the most critical. And we combine that with the EPSS score, and this is the exploit predictive scoring system. The score is data driven, so it gives you an estimation of how likely this vulnerability is going to be exploited out in the wild or out in your hospital. So just like we balanced the business criticality and patient safety we saw, we have to balance these two scores. So as I mentioned, there's more risks than there is time in the day. So we need to see not just what's the most common and vulnerable systems, but how likely it is that that vulnerability will be exploited in your hospital. And we can do this in a cool way where we can actually put it on this fancy looking map. And Chad, I was hoping you could talk to this slide on how Scenario combines these two scores.
Yeah, certainly. So I think anyone getting into a cybersecurity project, whether you have a background in cybersecurity or not, has seen the mistake or made the mistake of saying, all right, we're going to go in and we're going to squash all the vulnerabilities. We're going to get rid of everything. And the reality is there's always a happy medium here, because when you go in, you run a scanner, you run a passive analysis engine like ours, whatever the case may be, you're always going to find far more vulnerabilities than you know what to do with. It's just a never-ending list. And so when you see that large volume, it can be incredibly intimidating. It can actually lead to programs being shut down because they're seen as an unwinnable situation. So the approach to not only finding the risk by severity, but balancing them with likelihood is incredibly valuable. Because if you look at this heat map, you see a bunch of really big blue bubbles there. And effectively what that's saying is, okay, it might be a high risk or a high severity, but the likelihood of it being exploited is incredibly low, or the impact is incredibly low, or vice versa. You know, it might be incredibly likely, but if it does happen, it's not really going to impact patient care. It may not impact the business at all. That's when we can push further down the road. So when you start to look at this, and again, this is from our platform based on one of our customers with anonymized data, of course, when you start to look at it, you take all these thousands of vulnerabilities that are found, and by adding the likelihood, you actually only see that kind of pinkish bubble in the right-hand corner. So we take often thousands of vulnerabilities and whittle them down to the top, I don't know, 50 to 100, you know, just rough numbers, that should be addressed in a very timely manner and then help people chip away. And it's not uncommon for us to see customers go and aim for 2 to 3% reduction every quarter in vulnerabilities. And what that does over time is allows them to focus on the really critical ones that are very likely, and then secure their environment over time. So the last thing we want to do is discourage someone that's undertaking the right steps by just putting up a huge volume of issues that they don't know how to address. Showing them the clear steps they need to take based on both the criticality and likelihood is incredibly valuable.
Yeah, I like the way you put that, where you chip away at it. You know, cybersecurity, it's a journey, it's a process, and this sort of scoring really helps us know where we can get the biggest bang for our buck, where we can focus our time with that patching or updating firmware and software. So that's why I love this screenshot here.
You have to be methodical about, you have to be methodical about all this stuff. You have to realize you might get attacked tomorrow, but that attack might last, like your slide earlier in the presentation, it might last 3 months before they actually execute on it, at which point we'll probably find it and prevent the attack beforehand. So the methodical nature rather than a hectic one is always really valuable.
Absolutely. So this step 3 here, this is where things get a little bit more interesting and in my opinion, a little bit more fun. So we get to use all that information we just spent so much time gathering and documenting, and we get to turn it into our ally. So we start by finding which one of your systems where the manufacturer has pre-approved any level of operating system patches. Whether it is, some manufacturers have pre-approved all critical patches, and in some cases, you're going to find manufacturers for certain models have pre-approved all patches. You can see here, this is an actual clip from an MDS2 I found where there's a question on there. Can the operating system be automatically patched? And yes is checkmarked. Another thing you'll find on some MDS2s is, can security patches or other software be installed remotely? And the answer is yes. This is really powerful for us because the more we can automate, the better. In an ideal world, we'd automate all of it and our life would be a little bit easier. However, we also have to take into consideration not everything makes sense to automate, especially in our critical areas like our EDs and our ICUs. here we don't want to automate patches, but it's still really important to understand which ones can be patched and when. So you're not waiting on the manufacturer's timeline to do some of these patches. You can do it on your own time and your own 40-hour schedule instead of in an emergency or having to consistently go out to their website and see, okay, which patches have been approved and which ones haven't. Because sometimes those timelines they're supposed to be every month. Sometimes it's every couple of months. Sometimes you don't know if you're going to get it at all. So we really need to make sure we can do as much of this automation as possible. And then next part of that is optimizing. You know, for optimizing these patches and remediations, there's a ton of device level actions that you may not know that you need to do. So that's where we want to look at somewhere like Scenario. And Chad, how do you recommend we streamline this process?
Yeah, absolutely. So that collective wisdom that I was talking about combined with automated analysis gets very, very powerful here. Effectively, if you're automating the discovery and analysis of all those devices, passively, of course, we don't want to be hitting those devices and taking them offline, and then get the clear guidance on what should be done to protect those devices, you're no longer sitting there trying to spend cycles, figure out exactly what you need to do. Instead, you're getting a list of things that you should be doing. So you can see here, if you kind of blow up the screen, if you're watching at home, there's a bunch of patches that should be done. But in some cases, it's only a dozen, maybe less, that are very clearly guided. So what we're doing is we're taking HTM teams, we're removing a lot of the confusion, giving them very specific lists of things that can do to patch framework, patch their firmware, to update their operating systems, etc. So it really is limiting thinking whenever possible and problem solving and allowing the HTM teams to get right down into safe action.
Yeah, I love it. So this, yeah, really helps us know where we can spend the most time, can get the best bang for our buck. And then as we get more mature with our program, we can move into things like expanding our risk reductions into the network. What we run into in this space is a split in skill sets, where your IT and network teams don't really understand medical devices as well as they should, and your HTM team doesn't always understand the network side as well as they should. So this is where it's really important to get the right training or the right individual to bridge the gap in that knowledge. And this is actually what my role is with Sodexo, where I work with the Sodexo HTM folks, the biomeds and imaging guys, and I work with your hospital IT folks, the directors of ITs, the networking folks, and then I work with the Scenarios of the world to coordinate and guide how these network actions take place on medical devices. As a matter of fact, I'm in the middle of a project now working with an account determining how many of their medical devices actually need external internet access. And it turns out not many do. So we're integrating their IoT software, which just so happens to be Scenario, into their Cisco systems to create some network policies, then test those policies, and then finally we implement those policies. And then, Chad, I was going to see if you would be able to speak to how Scenario handles these policies and network actions.
Absolutely. And I can talk on this for hours if I have to, but I don't think, I'll try to avoid that if I can. At the end of the day, some devices just cannot be patched for whatever reason, right? They're old, patches aren't available. They may be too sensitive to patch on a regular basis. They might need additional testing. It might not be worth it to take them offline. There's a bunch of different reasons, depending on very specific use cases, why individual level of patches might not be the right path. Additionally, even if a device is fully patched, if it is not deployed correctly, it could be a really big issue. And I'll give you a great example. There are hospital robots that kind of roll around some hospitals. They deliver linens, they deliver medications, things like that. We've seen incidences where they're fully patched, they're properly secured, but because they were deployed incorrectly, they were accessible to the outside world, meaning you could potentially control them from the outside world. So we need to make sure that the devices are as secure as possible at the device level, but also we're considering the full kind of topology of the network. We're considering all the different components that may leave them susceptible to attack. And this is where an approach called network segmentation becomes incredibly valuable. This is a standard approach that's been used in other industries for about 15 years, maybe a little bit longer. And the easiest way to explain it is only allow devices to talk to other devices as need be. So for example, if you have 1,000 IV pumps, those IV pumps don't need to be talking to each other. They need to be talking to nursing stations and a few other things, but they don't need to communicate with each other. The challenge becomes when they just get deployed all together, they can talk to each other. If one gets infected with ransomware, then that will spread to the others very, very quickly. So one of the core pieces of technology we have is not only identifying the devices that we talked about earlier, finding out where they are, but also seeing the communication patterns, because as I said earlier, they're very verbose, and then putting rules in place and policies in place that limit communication only to as needed communication. This is one form of this is considered east-west segmentation, meaning kind of lateral movement should devices talk to each other internally. Another is north-south. Should a device in a hospital talk to something on the outside world or at a higher order? So at the end of the day, if a device can't be secured, or if it's as secure as possible, but may face some kind of configuration or deployment issue, we can start to protect things at the network level using approaches like segmentation. And these are complementary to other network level hardening approaches like vendor access controls, or making sure that external communications that are needed have the least principle of least privilege. So this is a little bit more technical than a lot of biomeds work with every day, but understanding that these protections exist so that you can then go talk with your IT and security team to make sure that they're properly practiced at the network level is incredibly valuable. With that in mind, Ryan, I wanted to ask, you see a lot more of the teamwork side of this, right? You brought it up earlier, so I'm going to ask it now. You have to bring my team together, the IT team together, the biomed team. There can be some natural tension in there, particularly if it's a ticket-driven system. How do you handle that? How is your team taking that approach to actually building the teams and then rolling the security practices in?
So great question. What I've found is honestly the best way to do this is you have to get these folks in the same room together. You have to get them talking and find out where, because I said both sides kind of have their knowledge gap, but when you get them in the room and they start talking, they realize they know a little bit more than they think they do. The networking guys, they know a ton about the network and they know what devices are on the network, but they don't, where they kind of lack is where biomed comes in is, should these devices be talking to more than just its server? Is there some sort of vendor that's remoting in to service the equipment? You have to have these communications so they can understand where the segmentation should happen and how we can guide it, and how both teams are really vital to this. Because the other thing that the IT and network teams don't always understand that the HTM folks are very familiar with is those workflows throughout the hospital. They know which departments operate at which times. Even though hospitals are 24/7, they'll understand when might be a better time to do some sort of these segmentations for departments that are running 24/7. So really just getting folks in the same room, talking, and defining some of that language and whittling out some of that gray area is the way to go. So what I recommend and what we do with a lot of our accounts is we have a monthly IT CE meeting where you have your clinical engineering, leadership, maybe if they have a cyber person or a network guru, they're in the meeting. Then you have your network, IT network team, even your CISO in there, and they can talk about what's most important.
It's the pizza party approach to securing healthcare, right?
There you go. Yep, free pizza. That's the key to everybody's heart. And I think that's really it's really important to find out, like I said, where both sides have to contribute to this, because it can't be just one side pushing it and the other side not. And that's where having some additional training, having some additional communication is really important. So. let's look at, well, let's summarize this. Now we've gotten through our 3 steps. So we have 3 different actions, and within each one of these actions, we kind of have different maturity levels for that action. So when we start, we need to expand. Again, we're going to expand from that bare minimum data collection into a full collection of our critical data elements, as well as the network capabilities of those devices. We're going to embrace gathering those MDS2s, digitizing them. And then we're going to start prioritizing all of that with business criticality and patient risks, and then try to optimize that prioritization of our vulnerability scoring. And then step 3, automate as much patching as we can where it's safe. Then we optimize our efforts for remediations, and then finally expand that medical device protection to the network level, working with our hospital teams, not working against them like sometimes happens in hospitals. So what I also want to do is, as we close out, is I will, at least with this part of the presentation, is I want to do a little quick promo, because Sodexo and Scenario, we came together, created a partnership where we're offering a free medical device cybersecurity risk assessment using just an export of your CMMS. So it's really cool what these guys are doing and what they can determine from just a little bit of information. And it's mostly just the manufacturers and models that you have in your hospital, no other proprietary or hospital specific information. And then also on top of that, I know, Chad, you have a new white paper coming out soon as well. Is that correct?
Yeah, that's right. So we're talking a little bit about extending medical device cybersecurity based on common industry trends. So that's going to come out. It's broken into 3 nice sections with very actionable steps you can take, from CMMS analysis to really deep network level segmentation. So really excited to get that out the door.
Awesome. Now we got a few more minutes before I want to jump to questions. So I was just going to do a quick overview about how Sodexo handles HTM cybersecurity. And if you're not a Sodexo employee, maybe there's something you can learn or questions you can ask. So just a quick couple minutes on this. So obviously, as cybersecurity risks continue to grow, Sodexo is also growing our cybersecurity program. So we offer 4 different levels of cybersecurity to really meet you wherever you're at in your journey, whether you're just starting or you feel like you have a mature process. We offer a full on-site cyber programs. We even have remote support for these cyber programs, for the full device management, including that full collection of critical data elements, operating system patching, device hardening. We also have what I think is one of the most robust risk assessment processes that takes into account 25 model-specific risk factors. We have this growing inventory of MDS2s we talked about, and then we try to do continuous monthly KPIs and reporting so our customers know where we're at with the process, and we even customize those reports so we can capture what's more important for them. We offer vulnerability scanning and assessment, just like I just spoke about, so we can catch all those most important vulnerabilities, prioritize them to maximize success. And Sodexo cybersecurity practices, we are aligned with the NIST cybersecurity framework. So you don't have to go through and read all of those frameworks and decide which one's best for you. We like to say we can turn industry best practices into your practices. And then lastly, we're partnered with a variety of cybersecurity industry leaders, such as HISAC and Amy, as well as Scenario, who was gracious enough to lend me Chad for today's presentation. And speaking of Chad, I want to give you a couple minutes to talk about Scenario.
Yeah, absolutely. And before I do, I do want to talk about, bringing in teams like Sodexo, particularly if you're a smaller rural hospital that doesn't have a lot of access to talent in your area for whatever reason, or if you're, not smaller rural and just having a hard time building out a cybersecurity team. Building out a team that has a background, that has a process, is incredibly valuable. It's going to speed up your security practices. It's also going to be price competitive. So highly recommend anyone look at MSPs and MSSP type programs. With that in mind, we did talk a little bit about CMMS analysis as we went through today. One of the challenges we find is that while we offer really in-depth technology that we simplify for healthcare, that can still be a bit daunting in some situations. So as Ryan was mentioning, we've simplified it even more, where if you do a very basic dump of your CMMS data, again, no patient data, no sensitive data whatsoever, we can do something as simple as device, manufacturer, a couple other columns, and we can give you a really good snapshot of the risk that you have based on that CMMS data. It's not going to be comprehensive. It's not going to be, as comprehensive as getting our collector on site. But Ryan, if you go to that next page, it's going to show you in very quick order, often less than a week, the number of devices you have, the risks they face, the prioritization of actions you have to take, all with in under 10 minutes of our customer work, and then an hour-long readout call. So if anyone wants to engage our team, if you want to engage the Sodexo team on this, reach out to me at chad.holmes@signero.com, reach out to Ryan, or reach out to your other contacts, and we are more than happy to kick this off and make sure that you have a full understanding of the devices and the risks they present to your environment. Also, Ryan, if you want to go to that next slide, we do have that new white paper coming out where we're talking about extending medical device cybersecurity. HTM and biomed teams are the backbone of a lot of cybersecurity implementation, right? You may not be the people creating the tickets, but often you are the people doing the work. So we wanted to make sure that some of those rules and recommendations are broken down. So that is available on our website now. And Ryan, I will hand it back to you for questions.
Awesome. So this will be the last slide for today. I put my email here, ryan.gonzalez@sodexo.com. There's Chad's email as well. So if you are more interested in learning about Scenario or the full HTM program and cybersecurity program that Sodexo offers, you can email us. Or if you have any questions you don't feel comfortable asking today, or you think of something later, you can reach out. But for now, let's open it up to see if there's any questions or comments in the chat.
Okay, thank you so much. Got a few questions here. The first one is, if you are just starting out your data collection, how do you collect all that information without taking too much time from your team?
Oh, so that's a really good question. So this is the task that a lot of biomed programs are faced with. There's a lot to do, and there's not enough time to do it. So my recommendation is you have to, when you're starting out, you prioritize during all of your current equipment service. So all those different touch points, those are opportunities to collect that data. Especially, you always start with incoming inspection. You already have it in your shop, you're touching it, you're setting it up, you're putting in that information in a lot of cases, and then your preventative maintenance, your corrective maintenance, work orders. Anytime the device comes to you, that's the perfect time to start gathering that. And you're going to find over the course of a year, you're going to collect a lot of that data just through your current practices. So that's really the first step. And then after that, you see what's left over and you prioritize the collection of that data based off of some of these business criticality and patient criticality that we talked about, or if it's something that we're the vendor. Because what we run into with imaging and lab equipment is there's certain menus where this data lives that you can't access because it's password protected. Well, grab that when the vendor is coming. When you've already paid the vendor to come do some sort of PM or other touch point on the device, that's the perfect time to grab them and you can get it for free. The other option is you just get a software like Scenario and Chad will do it for you.
You don't want me doing it. I will get my team to do it. So the reality is, the thing that makes a lot of these devices so vulnerable to attack, their chattiness, their connectivity, is also what makes them incredibly discoverable. As long as they're on the wire, as long as they're sending bits and bytes to other places, they can be discovered, they can be passively analyzed, and they can be shown to you. The reality, it's a mix between the two worlds. You're going to always have onboarding processes. You're always going to have your biomed teams doing their processes. But if you want to get a better idea of what's out there now and monitor that in real time, long term, that's valuable. From our side, we get a full inventory very quickly, often within a few days. And then we take about a month to really hone in on that last kind of 2 to 3%. But the reality is, if you start tomorrow, by middle of May, you're going to have a full inventory. You're going to have communication patterns. You're going to see external communications. And the reality, in the grand scheme of things, that is a very, very short turnaround time.
Yeah. Well, the other thing I want to say real quick to kind of expand something you mentioned was process. So if you don't have a software-like scenario to help you, you really have to build it into your process of incoming inspections, your process of preventative maintenance, and those devices where you don't have those touch points, you have to build a process and a timeline around doing it so you aren't trying to take it on all at one time, because it's too much. So.
Okay, another question that's come in. What do you do when you're having trouble getting the MDS2 from the manufacturer?
Yes, I think anybody who's tried collecting a bunch of MDS2s has run into this. There's certain manufacturers who won't talk to you without getting a PO first, and there's other manufacturers who are smaller and don't have one to provide you. So ultimately my recommendation is you have to build this into your capital planning team. Your hospital should have a policy, and this is what a lot of hospital systems are moving to, where you have a hospital policy where you do not sign off on any network connected medical device purchase until you get that MDS2 provided to you. You really need to have a senior member of your clinical engineering or HTM program that has sign-off power for your department, so they can help govern that. And when you tell a manufacturer that you're not signing off on this purchase order until they give you the MDS2, it's much easier. They'll scramble to get that MDS2 to your inbox versus you having to really fight to get it.
That's such a professional answer, and I'm going to go to the other end of the spectrum there. One of the great things about working in cybersecurity is you work with very clever, somewhat devious people sometimes. So I'm not saying we're hacking into anyone, we're not doing that, but you can do a lot on the phone to convince people to give you the data that they should be giving you anyway. Of course, once we collect it, it's available to all our customers. But calling up, saying you're working on behalf of a hospital, this, that, our team has become very, very good at working with somewhat reluctant manufacturers to get the data that our customers should have. So I prefer we do it Ryan's way. Just know there's a backstop of a
Yours is more the
clever
grassroots
way, let's call it.
Yeah, we'll call it
Let's call it
grassroots. Yeah.
Okay, another question here is, we're having trouble hiring people that have both medical device expertise and cybersecurity expertise. How do you recommend we address that?
So unfortunately, this is the whole HTM and cybersecurity community where cybersecurity, it's growing so quickly. There's not enough graduates or certificate holders to fill those. I think I saw a stat there was projected to be 1 million open cybersecurity positions in the next few years that go unfilled. And then on the HTM side, we have so many folks who are retiring that when you combine those two, this is what we call the unicorn skill set of finding someone that has both medical device experience and cybersecurity experience. So at Sodexo, we believe it's best to home grow your talent. You know, almost every biomed shop has 1 or 2 folks who love taking on all those network related work orders or network integration problems. When there's a patient monitor that they get the call, it's not sending HL7 to its EMR, you know, he's the one guy who's always grabbing that work order. Oftentimes those are the best folks to kind of train up into becoming your cybersecurity guru. At Sodexo, we also require all of our HTM associates to take a 6-week IT/cybersecurity training. And then if we have somebody who is kind of that guy who's much more interested in the network stuff, we offer more cybersecurity specific certificates through CompTIA. So I also advocate looking outside of your HTM staff and looking at other medical device personnel within your hospital system. In particular, some of your IT staff, like a system analyst, those are the folks who are managing a lot of your device integrations. That when you have that patient monitor that is integrating to your EMR, this is your software person that is building that integration and mapping it. So they have some understanding on how both sides work. So those are 2 of my recommendations.
Yeah, and I'll add to that, which is that could be my boss that asked that question. It could be your boss. It could be anyone in this space. it's really, really hard to find people with cybersecurity and medical device expertise, or just one or the other too, right? And they command a high premium. The reality is leadership in this space has to invest in training people, finding talent. Maybe that talent leaves, maybe it stays, but if you don't train them up, you're not going to have the expertise you need. The other side of that is having partners and technologies that span across multiple hospitals also leads to a collective wisdom, right? So someone like Ryan's team, who has dozens and dozens, probably more customers, don't need to put that on you, but lots of customers, can take the expertise from customers in extreme situations and spread that across all of them. So you don't necessarily have to find the talent to put it in-house to grow everything from scratch. There are services out there that will do that, like the Sodexo team does.
Yeah, that's actually something I'm working on as one of my projects, is taking all those lessons learned from those many accounts that we're in, some of the projects I'm working on, and how do we apply that to other hospitals that are having the exact same problems. Because what we find is a lot of hospital systems, a lot of biomed shops, a lot of IT hospital networks have the same exact problems as the other ones. So we really can apply that across the gamut.
Okay, we've got time to squeeze one more question in. You talked about several risk areas that are common among different healthcare facilities. In regards to new and developing risk areas, what are your thoughts with a lot of items moving to a cloud-based service?
So that's definitely a concern, and that's where you have to know what medical information your equipment is sending. You have to kind of have that understanding of what parameters, what devices are just sending unidentified numerics versus which ones are sending numerics that also are accompanying MRN numbers, patient names, that sort of thing. So having that understanding helps you know where to spend more of your time securing. And that's also where you put a lot of these network segmentations in place as well.
Yeah, and from my side, I think the cloud environments are incredibly secure. That doesn't mean they're completely secure. You still have to do your due diligence. You have to dive deep into them. But the reality is that the major providers out there, and we all know the common 4 or 5, they have massive, massive security teams. They have massive security budgets. They invest heavily there. There can still be deployment issues. There's still data that you have to protect. But knowing that effectively you're just renting someone else's servers and there are thousands of people working to protect them, that goes a really long way. And that's one of the reasons we've seen a huge shift to cloud adoption in healthcare in the last, say, 5 to 7 years, where it's really kind of forbidden up until that point. And now people are realizing there's business benefit. There's still a lot of additional security measures that they offer that maybe a homegrown or internally deployed system just hasn't considered.
Yeah, well, it does add a couple things to consider. One of the things I always like to talk about is understanding if your medical device is encrypting data before it sends to those cloud services, because a lot of times some of these attacks will do like a man in the middle where it's intercepting those transmissions, and then also those having unique active directories for signing into those. So with password protections and good password policies.
Okay, that's great. We coming up to our hour. I have got other questions that have come in, Ryan and Chad, so I will forward them to you after the webinar so you can reply at your own convenience. So thank you once again, Ryan and Chad, for your time today and for a great and informative presentation. I'd like to encourage everyone to visit today's sponsor to learn more about the products they provide for the industry. So please visit us.sodexo.com/HTM. As promised, the answer to today's trivia question is blue crab. So congratulations to our winner, Fred Donnelly. Just a quick reminder, you can obtain your CE certificate by completing the post-webinar survey, which will be emailed 1 hour after the completion of today's webinar. You must complete the survey to receive your 1 CE credit from the ACI, and you'll be able to download the certificate directly from your computer once the survey is submitted. If you have any questions, you can reach us at webinar@mdpublishing.com. We'll be back next week with another webinar, so please visit webinarwednesday.live for more details and complimentary registration. Thanks again once for your time today. Hope you enjoy your day and see you next week.
Mm.